Hello, my name is Danielle Burdette, and I am completing a comprehensive head-to-toe assessment on my patient who, for the purpose of patient privacy, we will call Miss Smith for the rest of this assessment. I will be doing all systems on her, and I'm going to explain everything to her as I go through this assessment. Hi, Miss Smith. My name is Danielle. How are you? Before we get started, I'm just going to wash my hands. And I would do that before I actually shook her hand to not keep down any infection control issues that we have. Today I will be doing a comprehensive head-to-toe assessment on you. What that means is I will be assessing your neuro system, your cardiovascular system, your pulmonary system, all of the organs in your body, just to make sure that there's no abnormalities your doctor needs to know about, and make sure that in general your health is doing very well. As we go through it, I'll explain it to you. If you have any questions, please let me know. All right, at the beginning of this, we already took Ms. Smith's vital signs. Her blood pressure was 120/75. Her pulse was 78. She had a temperature of 97.8. And her respirations were 16 to 18 beats per minute with 100% oxygen saturation on room air. To begin with, I'm going to ask you your name.
Miss Smith.
Miss Smith. Miss Smith, can you tell me where you are?
I'm at the doctor's office.
And can you tell me what the date is?
Today is November 23rd, 2014.
Okay. Miss Smith, can you clap your hands for me? Alright. By doing this, we went through the Glasgow Coma Scale to be able to assess her level of consciousness, and Miss Smith will earn a score of 15 because she is responsive. She is spontaneously responsive. She can state her name, where she placed in person, and then she can also state the time, as well as able to follow commands when I ask her to. Next, Ms. Smith, I'm going to assess your skin and your hair, and what I'll do is I'm just going to check for any abnormalities. I'll explain it as I go through a little bit better, but we're going to start with your hair, and I'm just going to palpate her hair, noticing that it is healthy with minimal breakages, no dandruff, no redness to the scalp noted. Very clean, well kept. I'm also going to look at your nails, both on your hands and on your feet. And I'm noticing that the color is appropriate for ethnicity. It's well around rounded edges, clean cut, very clean, both on the toenails and on her hands. She's got very well manicured feet and toes. Next, I'm going to do an assessment of her skin, and for the sake of her privacy, we've already done the assessment on both her legs and her stomach. She did not feel comfortable showing that on the camera, so I will tell you my findings as we go through it, but we'll just go ahead and start with the head and neck. I'm going to look behind you as well, looking for any lesions or rashes or scars. And we don't note anything back here. Now, Miss Smith, what I do notice is I notice you have a small scar on your lip. Can you tell me about that?
When I was about 5 years old, I fell and hit some metal stairs and had to have stitches on my bottom lip.
Okay. Does it give you any problems now? That was back when you were 5 years old. So does it give you any problems now?
No, it does not.
Okay. And next, I've seen one scar right here on the edge of your cheek. Can you tell me about that?
I had a dog jump on me when I was about 2 or 3 years old.
2 or 3 years old, you had a dog jump on you? Okay. And did you have any stitches to repair it?
No.
And your doctor's aware?
Mm-hmm.
Okay. Next, I'm just going to look at her arms. And not noticing any lesions or rashes, any scars at all. There are some mild freckling, but no skin tags or moles noted at all. The same with her legs and her lower legs. There were no abnormalities, no spider things noted. Everything, her color is appropriate for her ethnicity. There's no odor noted. Perspiration is normal for her ethnicity and female. She is a 26-year-old female, but overall we can say that she is clean and has no abnormalities. Same for her stomach. When we looked at her stomach, there was no abnormal findings noted. Next, we're going to look at her spine. Ms. Smith, what I'm going to do is I'm going to ask you to stand up, and I just want to look at your spine to note and see if there are any curves that we should know about. What I'm going to ask you to do is if you'll face the wall, and I'm going to ask you to take your hand and touch your feet with them. And while you do that, I'm going to look at your spine. Now, we did this already with Ms. Smith previously, and noticed that there was no curvature in her back whatsoever, no kyphosis, and no scoliosis. Thank you, Ms. Smith. You can stand up for me now. And if you'll just take a seat for me again. Next, we're going to palpate and auscultate your temporal arteries. Okay? I'm going to do it one at a time, noting that they are both strong. Okay, and I'm also going to auscultate them. Okay, and there are no bruits noted. Next, I'm going to ask Ms. Smith we're going to do range of motion for your TMJ. I'm going to ask you to just move your jaw forward. Can you see that? I'm going to come down here so they can see it a little bit better. Move your jaw, bite up and down. Okay, and I'm looking for any popping or any locking feeling. You haven't experienced any discomfort during this process?
No.
Okay, and then I'm also going to we're going to test and just assess for any abnormalities, and none were noted. Next, I'm going to assess her trachea and placement of the trachea. Trachea is noted to be midline. No swelling or inner tenderness noted. I'm also going to have you swallow, Ms. Smith. And then the swallowing, we're checking the thyroid placement is there. Go ahead again. And then I'm going to auscultate her thyroid as well. And no abnormalities have been noted. Next, we're going to do an assessment of Ms. Smith's lymph nodes. We're going to start with her pre-auricle, and I'm just going to do light to deep touches. You feel any tenderness or there's no swelling noted. I'm going to come up to the front, and these are the post-auricle. No tenderness or swelling noted. Next, we're going to go to the occipital, which is going to be on her back. I'm going to be doing light, and I'm just going to show you from the front to the back. And on this side as well, bilaterally. Okay. Next, Ms. Smith, if you just face your face this way, what we're going to do is I'm going to come down here and I'm going to test your premandibular and your premental. Feeling no tenderness, no swelling noted. Next, we're going to go down the cervical, deep cervical line, and the clavicular line. No tenderness was noted, no swelling, no pain. All right, next we're going to assess Ms. Smith's eyes, and we're going to do that several different ways. I have a pen line, and we're going to start off with just assessing Ms. Smith's going to check and see if her eyes react to light correctly, if they accommodate well. I'm going to start right there, and I'm going to bring this light into your eye. And do the other side as well. And what I'm noting is that Ms. Smith's eyes, her pupils both are about 3 millimeters wide. They are round, reactive to light, and they accommodate to the light as well. So no abnormalities were noted here. Next, we're going to just assess her peripheral vision. And Ms. Smith, what I'm going to do is I'm going to ask you when I bring the light. I'm going to start with the light up here, and when you see it in your peripheral vision, you're going to look at me, and when you see the light, just tell me, say yes. Okay?
Yes.
Okay?
Yes. Yes. Yes.
Going to come from the bottom as well?
Yes. Yes.
Okay. No abnormalities were noted in this assessment of Ms. Smith's eyes. Next, I'm going to do we're going to do a cardinal field gaze assessment, and I'm just going to ask Miss Smith to look at me, to only follow the light with her eyes, not with her face. Okay? So Miss Smith, if you will just follow this light with your eyes. And with this, we're noting that there's no astigmatism noticed at all. She is able to correctly and accurately follow the light. No abnormalities have been noted. Next, we are going to do the Snellen eye chart test. Now, for the purpose of this test, in the room that we have, the only way Ms. Smith can assess her field of vision is to stand with her back right here. If you'll stand up, Ms. Smith, and with your back against the wall. We have the Snellen eye chart on the opposite wall, 20 feet away, and I will film this part again so that you can see it a little bit better. Ms. Smith, what I need you to do is to read the smallest line possible from here.
D-E-F-P-O-T-E-C.
Okay. Now Ms. Smith read from the 20 level, which means she has a 20/20 vision. And I'm also going to ask her to read a vision test card, a near vision test card. Ms. Smith, if you'll stand right here in front of me, what I'm going to ask you to do is I'm going to ask you to hold this piece of paper about 17 to 16 inches away from your face. If you'll take that, and I want you a little bit closer. If you'll just read the smallest line you can.
D-E-C-L-P-T-O-F.
Okay. Can you read it one more time?
D-Z-E-C-L-P-T-O-F.
Okay. Ms. Smith had no problems reading that at all. I did, actually. And she has no abnormalities noted, or no problems with near vision noted as well. I'm going to just put this back real fast. All right. Next, we're going to assess Ms. Smith's ears. Now, before we continue with this, Ms. Smith is 90% deaf. How long have you been this way, Ms. Smith?
Since I was 5.
Since she was 5. She does have hearing aids in both ears. And Ms. Smith, if you'll do me a favor, I'm going to ask you to stand up for me. We're going to bring your chair just a little bit closer to the camera so they can see you just a little bit better. And I'm going to ask you to hold your hair back on one side for me, okay? First, what we're going to do is I'm going to look inside your ear, and if you'll take off your hearing aid for me. We're going to assess to see if there are any objects in her ear, which I don't see. It's clean. No, she does have earrings on both ears, piercings on both sides. No swelling noted, no tenderness, no drainage. And if we're going to turn to the other side as well, and just do it on the other side, so they can see you. Thank you, Ms. Smith. I appreciate it. Now I'm going to do the same for this side, looking to see if there are any abnormalities, any objects in your ear, no swelling, no drainage. Everything looks good. Now I'm going to ask Ms. Smith to perform the whisper test. We've done this before, and she's not able to hear anything, but just for the sake of this assessment, I will go ahead and do that. All right, I'm going to whisper the words, and I'll tell you what I've whispered. Can you repeat that for me, Ms. Smith? Okay. I'm going to do the same on this side. Can you hear anything, Ms. Smith?
No.
Okay. Ms. Smith was unable to perform the whisper test, but otherwise, she has no problems with her ears. They are not abnormal in shape, size, or color. All right, Ms. Smith, we're going to have you come back to where we had you before. And you go take a seat. Next, we're going to assess Smith's nose. And what I'd like for you to do is I'd like you to close your eyes, and I'm going to ask you to identify a smell for me, okay? Can you identify what that is?
Hand sanitizer.
Yes, ma'am. Alcohol. Alcohol is a common smell that most people can identify. All right, Ms. Smith, you can open your eyes. It is midline on her face, an appropriate placement for her face. Also, could you take your finger and hold your nose on one side and breathe in and out on the other side? Noticing any problems with that? Mm-hmm. Okay, do the same to the opposite side. No problems noted. No swelling noted. I'm going to check her sinuses. Do you have any swelling or any tenderness here? Okay. No swelling, no tenderness noted to her sinuses at all. Next, we're going to assess Smith's mouth. And if you will just open your mouth wide for me. All right. And it looks like you had some teeth removed. Did you have your wisdom teeth removed, Miss Smith?
Yes.
Okay. If you will stick out your tongue for me and say ah. Thank you. There is no swelling noted, no redness to the mouth. Her tongue is midline, an appropriate placement in her mouth. I'm going to check your gums. The mucosa is moist as it should be. So we're having no problems with the teeth. It looks clean, and we know that I've informed Ms. Smith that it's very important to perform proper hygiene for the teeth, because the teeth hygiene and cardiac are very closely related to each other. Next, Ms. Smith, we're going to do an assessment of your chest. We're going to start with the breast exam, and then we'll move to the lungs. Now, Ms. Smith, we have performed a thorough breast and axillary exam of her earlier, and there is a lump on her right breast, which she has already shown her doctor. They did an ultrasound, and they did a biopsy of that lump, and it was found to be a benign cyst. She is aware of it, and she's also very aware that self-breast exams are very important. So, Ms. Smith, what I'm going to do is I'm going to ask you to raise your arm for me, and I'm going to demonstrate how to do a self-breast exam, okay? You're going to start here in the axillary, because a lot of cysts or a lot of lumps can start here, and I want you to just vary between light and hard tap touches all the way across your breast, back and forth, and then make sure to get under your breast as well. Okay? And can you do it for the other side as me as well, just so I can make sure you understand how to do it correctly? Okay. And Ms. Smith is demonstrating properly how to do this. And you know how often to do a self-breast exam, correct, Ms. Smith?
Yes, once a month.
Once a month. Exactly. Next, we're going to look at her lungs. I'm going to turn my notes so that I can just have a point of reference for when we get to our cranial nerves. But we're going to go ahead and I'm going to assess your lungs. We're going to listen to the anterior and the posterior chest, and then I'm going to also listen bilaterally, all right? So what I'm going to ask you to do is take deep breaths for me. And again. Again. I'm sorry, Miss Smith. Go again. And again. And I'm going to have you listen right here. Okay, and Ms. Smith, I'm going to ask you to stand up and turn to your back to the camera so that they can see me listen to your back. And if you'll do the same thing, I need you to take a deep breath. In and out. And again. Okay, I think you have a seat for me, Ms. Smith. We were listening for her lung sounds, which are clear. Each lobe was found to be clear. No rhonchi, no wheezes, no shortness of breath noted. When I'm looking at her diaphragm, it looks like she is evenly rising on both sides. No asymmetricalness noted. Okay. Next, we're going to listen to Ms. Smith's heart. We're going to start doing a cardiac assessment on her. We're going to start with her apical pulse, and I'm just going to count it for 30 seconds. Okay, I'm going to auscultate it first. Okay, and we found Mrs. Miss Smith's heart rate was 35 had 30 seconds, so that's going to give us a total of 70 beats per minute. Next, I'm going to just assess her extremities for any edema. No pitting edema, no non-pitting edema noted. Any tenderness here at all? No heat felt. Her legs were assessed previously, but we'll just go ahead and do it over again this time. But no swelling was noted in these areas as well. Okay. Now I'm going to listen to each of her heart valves, and I'm going to assess to hear if her rhythm and to note any irregularities. And we're going to use the diaphragm for this part. Okay, and there are no irregularities noted, no flutters noted. Next, I'm going to listen to her heart with the bell of my stethoscope, and I will be assessing for any clicks, gallops, any murmurs. And I'm just going to listen real fast for that. I'm just going to lift your breast up. Okay, Ms. Smith. No abnormalities were noted, no clicks, no murmurs, I listened to your S3 and your S4, and all the sounds came back normal. If you're noticing the lights going on and off, we are having a thunderstorm right now, so bear with us. Alright, next what we're going to do is I'm going to feel your pulses. We're going to start with your carotid arteries, okay? And it's very important to do this one side at a time so that Ms. Smith does not pass out on me. I appreciate Ms. Smith volunteering for today. I'm just going to feel this. And the pulse is strong. I'm just going to assess it with her radial pulse to make sure that they are the same. I'll do the same with her carotid, or with her apical pulse, making sure they're at the same time. And they're equal. Next, I'm going to feel the brachial pulses. Make sure, could you just straighten your arms out for me on both sides? Thank you. And they are even on both sides. We'll note the radial pulses. And we're going to skip the femoral arteries for just this time for the patient's safety and her privacy. We're going to move to the popliteal arteries. And there is a pulse that is strong bilaterally. We're going to go to the tibial pulses. And those are even bilaterally on Ms. Smith. Next, I'm just going to check the dorsalis pedal pulses. I'm going to put some of this out of the way you can see what I'm doing. And they are strong evenly on both sides, no abnormalities noted. I'm also going to check Ms. Smith's capillary refill. I'm going to take your finger like this, and I'm just going to press down, and I'm going to count how long it takes for the blood to come back to your finger, okay? And it is less than 3 seconds, which is appropriate for Ms. Smith. We'll check on this side as well. Less than 3 seconds capillary refill. All right. Next, we're going to move on to the neurological screening portion of this test. We're going to test each of Ms. Smith's cranial nerves, starting with the olfactory, going to the optic, ocular, trigeminal, the facial, the acoustic, the glossopharyngeal, her hypoglossal, and also the vagus nerve. But we're going to start out with the olfactory nerve. Ms. Smith, I'm going to ask you to do something you've already done. Close your eyes for me. And I'm going to ask you to identify the smell, okay? What does that smell, Miss Smith? Alcohol. All right, she did this earlier, but we're just going to test it one more time. Also, Miss Smith, you can open your eyes, but we tested the optic nerve when we did the peripheral vision test, and she passed that with no abnormalities. The next was the ocular test, and she demonstrated that that cranial nerve was affected when she did the cardinal field gaze test. She passed that with no problems and had no abnormalities, no delineation noted for that part of the test. Next, we are going to go to the ocular. Now, that will actually, cranial nerve 3, 4, and 6, which is the ocular, trigeminal, and the abducens, or the abdominal, trochlear, and the abducens. These were all found when we did her, I'm sorry, I get some excited sometimes. All right. Trigeminal was done when we were checking the transmandibular TMJ, trying to assess for that, and she had no popping or locking noted. So we demonstrated that the trigeminal cranial nerve was effective and working correctly. Facial nerve, we're going to assess this by asking Ms. Smith to just smile for me. All right, and can you puff out your cheeks? Having no problems with that. And then raise your eyebrows for me, please, Ms. Smith. She didn't experience any problems with this at all. Next, we're going to do the acoustic test, but we did that when we did the whisper test, and as noted, Miss Smith's acoustic cranial nerve is not working properly as it should because she cannot hear the whisper test. But we're going to move on to the glossopharyngeal and the vagus cranial nerves. And these were tested when we asked her to go ah, and we'll just do it one more time. Please go ah, stick out your tongue. And stick out your tongue. Okay. And her tongue is noted to be midline, acting appropriately, and by saying ah, she is showing that the cranial nerves are working properly. Next, we're going to do the accessory cranial nerve, and by doing that, I'm going to ask Ms. Smith to just raise her shoulders, and they are even. She's not showing any signs of having trouble raising those. So her cranial nerve number 10, the accessory, is working properly. Next, I'm just going to ask Ms. Smith to do her hypoglossal cranial nerve. And this is when I'm going to ask you to just stick your tongue in the side of your mouth like this. Stick your tongue out. I'm going to press it, and you try to not press back. Okay? Other side. Alright, Ms. Smith, it looks like your last cranial nerve is working effectively. We're going to move on, and I'm going to do a sensation, also the gyrophagia test, and we're running the stereogenesis. We're going to assess for stereogenesis by asking Ms. Smith to close her eyes and identify an object in her hand without looking. So Ms. Smith, if you close your eyes, I'm going to place an object in your hand, and I'm going to put it in the right hand, and I want you to just identify what it is without looking.
Hand sanitizer.
She responded that this is hand sanitizer, which is correct. Now, Ms. Smith, if you open your left hand, I'm going to place another object in your hand, and I just want you to state what it is.
It's a pen line.
Ms. Smith correctly identified my pen light and proved that she is not having any problem with the stereogenesis. Next, we're going to test for graphesio. And what I'm going to ask you to do is keep your eyes closed, and I want you to open both of your hands. I'm going to draw a number in your hand, and I want you to identify what number this is, okay?
7.
7. I did that on her left hand, and that was correct. Then on the next hand, I'm going to do another number, and I want you to identify that number for me.
9.
Yes. It was actually a 6, but those are both very similar objects. I'm going to do that side one more time just to properly identify.
8.
8. I did a number 8, and she correctly identified that. Next, we're just going to do point location. And what I'm going to do is I'm going to use a key, and I'm going to use the sharp edge of the key and the soft end of the key, and I'm going to ask her to identify the different sensations, okay? So I'm going to ask you to close your eyes. I'm going to place the sharp or the dull side, and I want you to tell me which it is, okay? I'm going to go to your left side.
Sharp.
Okay. Staying on your left side.
Sharp. Dull.
Okay. One more time. On the right side.
Sharp. Sharp. Dull.
Alright, she's correctly identified on both her arms. I'm going to move to her legs.
Sharp. Sharp. Dull. Dull. Sharp.
Okay. Well, I'm going to move to the other leg.
Sharp. Sharp. Dull. Dull.
Okay. She was able to correctly identify each of the sensations. So now we're going to move to muscle tone, the musculoskeletal part, and I am going to ask Miss Smith if she can raise her arms while I'm pressing against her and press them down. Okay? And I want you to do the same thing with your hands. Lift your hands up. Lift your hands down. Same with your shoulders. Okay? No problems there. We're going to do the same thing with your legs. Lift your legs up with me pressing down. I'm going to pull up and you press down. We're going to do the same thing with your legs. Press up and then pull down. And then I'm going to do the same thing with your feet. I'm going to ask you to press like you're pressing a gas pedal and then pull up. Same thing on this side. And there, and we might need to do this, come a little bit closer just so that they can see a little bit. Can you move this way for me, Miss Smith? I just want them to be able to identify. If you lift your legs up for me. I'm going to fix the camera a little bit more. Alright, Miss Smith, can you press against my feet? Good job. And then pull up against it. Same on this side. And pull up against it. Perfect. Miss Smith has demonstrated appropriate muscle tone for her age and her ethnicity. And so we're going to next, I'm just going to check her deep tendon reflexes. I do not have a reflex hammer, so I'm going to use the bell of my stethoscope to assess this. And we're going to start with the top of her knee. And I'm going to hit it here, and I'm just going to assess to see if your reflexes are acting appropriately. Okay? And this one we're active. Very appropriately. I'm going to do the back side as well. And we're also going to do her arms as well. And do the reaction there. I'm going to do the back side. Okay, and head reaction there. We're going to do the opposite side. I'm going to jump there. I'm going to do it on the back side. This is the brachial, and then kind of jump there. Okay, so Miss Smith demonstrated proper tendon reflexes in all of her reflexes. So we did the bicep, we did behind her knee, then tricep, and the patellar. Next, we're going to assess Miss Smith's sense of balance and her coordination. So Miss Smith, what I'm going to ask you to do next is if you'll just stand for me with your feet just hip width apart. And I'm going to ask you to close your eyes, and we're just going to assess and see how much you sway. It does not look like Miss Smith is having any trouble with too much swaying. She seems to be standing fairly evenly. Okay. Now, Miss Smith, what I'm going to ask you to do is I'm going to ask you to turn towards away from the camera, and I'm going to ask you to just do a heel to toe walk across like this. And if you'll come right where I'm at so they can see you on the camera, I'm going to ask you to just go walk heel to toe, and we're just going to assess your balance. And Ms. Smith seems to have good control over balance, not showing any deficits here at all. Last, we're just going to have you sit back down in your chair. And I'm going to ask you to touch your nose to my finger and back. 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 And then can you do it with the other arm, please, ma'am? And back. Touch your nose to my finger. And there we go. And this concludes the end of our assessment for Ms. Smith. She did not show any deficits other than her hearing. She does have deficits in that, but she sees her doctor. How often do you see this doctor?
Every 6 months.
She sees her doctor every 6 months to keep a regular check on it. She was educated on proper battery usage for her hearing aids. She was also instructed on proper soft breast exams, and overall this patient is in great health, having shown no signs of deficits other than the ones mentioned. All right, well, thank you very much. Hope you have a good day. Thank you for watching.